Hi, I'm Evan Simonson. I'm the podiatrist and foot and ankle surgeon here at Granite Orthopaedics. Arthritis technically just means inflammation of a joint, and that can happen for a lot of different reasons. One of the most common reasons that we see for ankle arthritis is osteoarthritis, which is an imperfection in the cartilage. So basically, for a number of reasons, the cartilage breaks down in the joint, and over time, with wear and tear and use and motion of a joint, you'll get degeneration. The degeneration of that cartilage often causes inflammation, and that's typically what's going to cause pain. Ankle arthritis is most often caused from trauma. So if you've had a ankle fracture, you're much more likely to develop ankle arthritis. Another common cause would be rheumatoid arthritis, and then sometimes ligamentous instability and things like that. Probably the most common reason why people come in for arthritis to our office is going to be pain. So again, with that inflammation of the joint, that happens for multiple reasons. That pain will typically in the foot and ankle present as stiffness, loss of range of motion. Sometimes in the foot, in areas of thinner skin, you'll get lumps and bumps, and those can be irritable in shoes. The inflammation that comes from arthritis will often create swelling, and sometimes that's actually the first symptom. People will notice that they'll have a swollen joint. And so it's not uncommon for me to have somebody just come and say, I don't really know why this joint is swollen, even if it's not painful, and we'll get an x-ray and maybe see that there's not perfect cartilage. Really severe arthritis often will start to create things called osteophytes, which are more commonly known as bone spurs. And so those are some of those kind of outcroppings that you may see. Bone spurs themselves can create pain from either pressure, sometimes tendon or ligament can be irritated by them. But really, they're just a manifestation of the joint as it becomes degenerated, kind of trying to stabilize itself and reduce its range of motion. In more advanced arthritis, as you have less and less cartilage, the bones underneath the cartilage can start to rub together. And that can create kind of a grinding sound. Sometimes you'll get a popping or a clicking, and that's called crepitus. More common in very severe arthritis. So when people come see me for ankle arthritis, obviously they're curious about the diagnosis, and then most importantly, they want to know what they can do about it. The way that I like to outline treatment options is going to be from most conservative to kind of most definitive. So for early ankle arthritis, often we're going to manage it with some sort of bracing that often will help decrease swelling and also reduce instability. And that can be a slip-on elastic sleeve brace all the way up to a really restrictive ankle brace. And we have some links to those on our website that if you're interested in, you can look into those. It doesn't have to be anything fancy. They shouldn't be very expensive. Orthotic shoes, your mileage may vary, but people like to try those things. And I certainly say try whatever works. That's easy. Oral medications such as anti-inflammatories, specifically non-steroidal anti-inflammatories like ibuprofen and Aleve, and there are some prescription versions of those, are helpful to reduce the inflammation that typically comes with arthritis. You can do topical medications like Aspercreme or Voltaren gel. Those are two options that some people have some luck with. Injection is also a reasonable option. So typical injections would be like a corticosteroid injection. So some people know it as a cortisone injection. Some people it's a steroid injection, same thing. In that case, we are injecting a steroid, which is a very strong anti-inflammatory, typically directly into the joint, and that will reduce inflammation. That usually sticks around for about 3 months, and in less severe cases, sometimes longer. More severe arthritis, sometimes we don't see a huge benefit for that. Other injections that are possible would be platelet-rich plasma, which is becoming more popular. If you have mild arthritis and you simply have some bone spurs and a few other kind of indications, arthroscopy, where we make 2 small incisions and put a small camera in the joint. Sometimes we can clean up small bone spurs with that to really buy some time and potentially improve symptoms, avoiding any sort of more invasive surgery. Which brings us to more end-stage arthritis. And that typically moves into 2 categories. And one of those would be ankle replacement, and the other one would be ankle fusion. Ankle fusion is a good option for people who have a lot of instability and other things going on. A lot of times we can correct more foot deformity that sometimes presents with this. When we do a fusion, which is where we join the bones of the ankle together, we're going to put a lot of stress on the surrounding joints. And so while it's very good, and ankle fusion is very good at alleviating pain at the ankle, down the road, the studies have shown that people do lose that satisfaction rate that they initially have because they get more pain from arthritis around the joint because all those other joints are trying to make up for that motion that's lost. So our goal with ankle replacement is to preserve that motion. And studies have shown that we're not going to get perfect motion with ankle replacement, but we'll get enough motion to allow you to walk normally, stand comfortably, and improve long-term outcomes by decreasing what we call adjacent joint or arthritis of the joints around the ankle, like the knee and the joints of the foot. Ankle replacement is a very good option for ankle arthritis for a number of reasons, but we have to be very selective about our patients because if you have a lot of deformity or laxity, instability, an ankle replacement can turn into more of a problem, whereas an ankle fusion typically will manage those problems better. One thing that I'll say is that not all arthritis is the same. In fact, most cases are different and very individual. So an important thing to do is to have a good, thorough discussion about not only your condition, but also the options that are available to you. You can visit us at graniteortho.com to schedule an appointment and find out about our specialists and what procedures we perform. We appreciate you for watching the video, and if it was helpful, go ahead and press like and feel free to subscribe to our channel for future updates.